So hepatitis is basically inflammation inside the liver. So that means the liver becomes swollen, and that usually happens when our body mounts an immune response to any foreign substance, anything which the body considers as foreign, and the liver gets affected as a collateral damage. So there are basically two main types of hepatitis. One is an acute hepatitis, where the liver gets swollen or affected all on a sudden in a matter of days to weeks. And the other type of hepatitis is a chronic hepatitis, which happens over a prolonged period of time, over months to years. Hepatitis B and C are usually transmitted by different mechanisms, but these are mostly blood-borne transmission. That means either it is due to a needle stick injury, or due to contaminated blood transfusion, or sometimes by sexual transmission, unprotected sex. Yes, hepatitis is preventable in a broad sense. It is not always preventable, but it is preventable in majority of the situations. For example, there are vaccinations available for hepatitis B, which is now covered in the universal immunization program. That means the babies born, they get vaccinated for hepatitis B. Even if someone has not been vaccinated at childhood, can always be vaccinated in adult life. Hepatitis A similarly has got its own vaccine. So these two are definitely preventable by vaccine alone. But more important than that, other hepatitis which do not have vaccines, they can also be prevented. For example, hepatitis E, which is a waterborne disease, can be prevented if we take care of what kind of water we are drinking. So the water must be purified. And the fecal-oral contamination which takes place during in the water pipeline can always be prevented. Similarly, hepatitis C can be prevented by careful administration of blood, so that the blood is properly screened for hepatitis C, and by avoiding unprotected sex. Now, hepatitis does not always come with a warning signs and symptoms, particularly chronic hepatitis, which is taking place over a long period of time. They hardly give any warning signs and symptoms, so that needs to be screened for time to time by different kinds of tests. As far as acute hepatitis is concerned, definitely comes with some kind of symptoms. It starts with a kind of febrile illness, and then it leads to loss of appetite and ultimately yellowish discoloration of eyes, which is called jaundice. So these are the warning symptoms of acute hepatitis. When someone gets jaundiced, they loses appetite, obviously there is an acute hepatitis. But for chronic hepatitis, there is no as such warning signs and symptoms. You need to get your bloods done and other kinds of tests as advised by the doctors. Hepatitis is curable. It always depends on what is the reason for that hepatitis and at what stage of the hepatitis it has been diagnosed. Majority of the acute hepatitis like hepatitis A and E are curable. Hepatitis C has also got very promising medications nowadays, so the virus can be completely cured. Hepatitis B, unfortunately, chronic hepatitis B cannot be completely cured, but there are wonderful medicines by which the number of viruses can be kept under control, and the damage to the liver can be always can be kept under control. On the World Hepatitis Day, my key message will be prevention is always better than cure. So for hepatitis B, hepatitis A, vaccination should always be completed. For hepatitis C, The risk factors should be always avoided. But most importantly, what is the most important kind of chronic hepatitis, that is a steatohepatitis, is that the body weight must be kept under control. Sugar should be always be tightly controlled, and there should always be done some regular screening blood tests and ultrasonography of liver to find out what is the current status of the liver.